Welcome to the deep dive. Today, we're going to be looking into shoulder pain. And you've sent over a bunch of different sources for this. It looks like we have some medical texts, we have some diagrams, even a personal story. So let's dive in.
It's interesting. We really do kind of take our shoulders for granted until they start acting up.
Yeah,
And it's amazing how much they can impact your life when they do.
you're not kidding. Even something as simple as reaching for a cup of coffee can become like a major obstacle.
Yeah.
Speaking of obstacles, we've got this book here, Shoulder Work Ahead by Dr. Mohy Taha.
Yeah.
He's a shoulder and elbow surgeon who's clearly really into this topic.
Yeah, and one of the things that really struck me about this book is how he kind of weaves his own journey into it. He started med school in Cairo and then went on to do fellowships all over the world. So it really highlights how that dedication to learning shapes an expert.
It definitely adds a personal touch, and that comes through in the way that he explains things too. He breaks down this complex anatomy stuff
Right.
in a way that's really easy to grasp, but he doesn't shy away from the details either.
And that's so important, especially with a joint that's as complicated as the shoulder. I mean, you're talking about bones, cartilage, the rotator cuff, ligaments, all working together to give you this incredible range of motion.
Yeah.
But because of that complexity, there's a lot that can go wrong.
And speaking of things going wrong, Dr. Taha outlines 8 common causes of shoulder pain in this book, some of which I had honestly never even heard of before.
Oh, really?
Like calcific tendinopathy.
Yeah.
Who knew you could get calcium deposits in your tendon?
Right. And it's fascinating because Dr. Taha highlights some lesser-known treatment options, too. Like, he talks about shockwave therapy for calcific tendinopathy. So it's not always a matter of going straight to surgery, which is interesting.
That's really reassuring to hear, actually, especially because he also talks about how common rotator cuff tears are. And those sound really serious.
They can be.
He even mentions a classification system, the PAT classification.
Right.
Which grades tears based on how much the tendon has pulled back from the bone, which sounds kind of scary.
Yeah, that classification is really key because it can directly impact treatment decisions. Like higher grades might mean that surgery is more likely.
Okay.
Which is why it's so important to see a doctor early on if you think you might have a rotator cuff tear.
So it's not just about treating the pain, it's about preventing further damage too.
Exactly.
So speaking of treatment, Dr. Taha covers a wide range of options in this book, from medications and physiotherapy to injections and even surgery. It's amazing how much has advanced in this field.
It really is. And he makes it clear that there's no one-size-fits-all approach.
Right.
Every case is unique. And the best treatment plan depends on getting a thorough diagnosis.
Which makes sense.
Yeah.
But I'm curious, what does that diagnosis process actually look like? Is it just a matter of getting an MRI, or is there more to it?
It's definitely more than just an image. Dr. Taha really emphasizes the importance of a thorough approach. And it starts with, taking a really detailed history. What's the patient's main problem? When is it worse? Then comes the physical exam, checking range of motion, testing specific muscles and tendons. And then, yes, imaging can play a role. Like X-rays, ultrasound, MRI, CT scans, they all have their pros and cons.
Okay.
So it's kind of like putting together a puzzle, really.
So it's like a holistic approach, which seems to be a theme with Dr. Taha.
Yeah, definitely.
I mean, even his discussion of the biceps tendon goes beyond just the anatomy. Like, he talks about 2 different surgical procedures, tenotomy and tenodesis.
Right.
And how one can actually cause a Popeye muscle.
The Popeye muscle.
Yeah.
That's one way to remember it.
Right.
But, it just goes to show that surgical decisions aren't always straightforward. It's about finding the best solution for that individual patient's needs and lifestyle.
Which leads us to something that really impressed me about this book. It's Dr. Taha's emphasis on the patient experience.
Yes.
He goes beyond just the medical aspects and talks about the importance of things like communication, empathy, and even the role of the hospital staff.
And that's one of the things that's so refreshing about his perspective.
Yeah.
He recognizes that it's not just about fixing the physical problem. It's about supporting the whole person.
And he even brings up these bigger picture issues like, the complexities of insurance and the rising cost of healthcare, which can be a huge burden for people.
Yeah, definitely.
And it just adds a whole other layer of stress on top of dealing with shoulder pain.
Absolutely. He doesn't shy away from those realities, And he actually advocates for more research in the field, too. So it shows a real commitment to improving patient care on multiple levels.
You can definitely tell that he's very passionate about this work.
Oh, yeah,
And his enthusiasm is kind of contagious.
it is.
I'm already feeling a lot more informed, and honestly, we've only just scratched the surface here.
There's so much more to explore.
Yeah. So in the next part of our deep dive, why don't we focus on a few specific conditions in more detail? That's good. We can look into some of the ones that you, the listeners, are most curious about.
Yeah.
So until next time, keep those shoulders moving, but be careful.
Welcome back to our deep dive on shoulder pain. Ready to dig into some specific conditions.
Absolutely. I'm especially curious about rotator cuff tears. You know, Dr. Taha really emphasized how common they are.
Mm-hmm.
And I gotta admit, it kind of made me a little nervous.
It's understandable to be concerned, but remember, knowledge is power.
True.
Understanding what we're dealing with can really help us make informed decisions about our health.
That's a great point. So for those of us who might not be anatomy experts, could you remind us what the rotator cuff actually is?
Of course. Imagine your shoulder joint as like a golf ball sitting on a tee.
Oh.
The rotator cuff is a group of 4 muscles and their tendons that act like a strong, dynamic sleeve. It basically keeps that golf ball, which is the head of your upper arm bone, snugly in the tee, which is the socket of your shoulder blade.
Okay, I like that image.
Yeah.
So it's all about stability, which makes sense, considering how much we use our shoulders. But what actually causes these tears to happen?
Well, picture those tendons like strong rubber bands.
Okay.
Sometimes a sudden force, like a fall or a hard impact during sports, can snap one or more of those rubber bands.
Ouch, I bet that's painful.
It definitely can be.
Mm.
But other times, it's more like those rubber bands getting frayed over time.
Mm.
You know, repetitive overhead motions, like throwing a baseball or even just reaching up repeatedly, can gradually wear down those tendons.
So it's not always like a sudden injury. It can be more insidious, developing over time.
Exactly. And as we age, those tendons naturally lose some of their elasticity,
Makes sense.
making them more susceptible to tearing. It's like that old rubber band that's been sitting in your junk drawer for years.
Yeah.
It's just not as resilient anymore.
That's such a good analogy. So let's say someone suspects they might have a rotator cuff tear. What are some telltale signs they should look out for?
Well, pain is the most obvious one, especially when you try to lift your arm
Yeah.
or sleep on that side. It's kind of like those frayed rubber bands protesting with every movement.
Right. And I imagine the severity of the pain can vary depending on how bad the tear is.
Absolutely. And that's where the PAT classification comes in.
Okay.
It grades tears based on how much that tendon has pulled away from the bone. Think of it like a zipper.
Okay.
A small tear might be like a couple of teeth separated, while a larger tear is more like the whole zipper's been unzipped.
So a higher grade on that scale means a more serious tear.
Exactly.
Dr. Taha mentioned that early diagnosis is super crucial for rotator cuff tears. Why is that?
It all comes down to minimizing damage and maximizing your chances of having a smooth recovery.
Okay.
The longer you wait, the more that tendon can retract, like that unzipped zipper pulling further apart.
Oh, I see.
And that can make surgery more complex if it ends up being needed.
So let's say you see a doctor and they confirm you do have a rotator cuff tear. What happens next? Is surgery always the answer?
Not necessarily. If it's a minor tear and you're not in a ton of pain or experiencing major limitations, conservative treatment might be all you need.
So what would that involve?
Think RICE. Rest, ice compression, and elevation.
Oh, yeah, I've heard of that.
These help to manage inflammation and give those tendons a chance to heal.
Right.
Over-the-counter pain relievers can also be helpful, and physiotherapy is key to strengthening those muscles around your shoulder and improving stability.
So it's kind of like supporting those rubber bands while they try to mend themselves?
Exactly.
But what if those conservative measures just don't work, or if the tear is more severe right from the start?
Then surgery might be the best option. And Dr. Taha is a big proponent of minimally invasive techniques. They've really revolutionized shoulder surgery.
Minimally invasive, that sounds way better than traditional open surgery.
It is. Instead of a large incision, they make tiny incisions and use an arthroscope. It's a small camera that lets them see inside the joint. It's like doing surgery through a keyhole.
Wow. Less trauma, faster recovery. That's incredible.
It is.
But even with these minimally invasive techniques, there must still be some risks involved, right?
Of course, no surgery is completely risk-free. But Dr. Taha emphasizes how important informed consent is.
Right.
You need to understand both the potential benefits and the risks before you make any decisions.
It's about being an active participant in your own care, not just blindly following doctor's orders.
Exactly. And remember, surgery is just one piece of the puzzle. Recovery involves a lot of dedication from the patient, too.
Yeah.
Physiotherapy, home exercises, and carefully following your post-op instructions are all crucial.
So it's a team effort, with the surgeon, the therapist, and the patient all working together. It's amazing to see how far medical technology has come. But it's clear that the human element is still so important, too.
Couldn't agree more.
So we talked about rotator cuff tears.
Right.
Earlier you mentioned I was also curious about osteoarthritis.
Yes.
It's a condition that seems to affect a lot of people.
It does.
And it often gets misunderstood.
Mm-hmm.
So maybe we could delve into that next.
And we're back for the final part of our shoulder pain deep dive. We've covered so much already, from rotator cuff tears to diagnosis and all sorts of treatments.
It's been quite the journey.
It has.
You know, something that really resonated with me from Dr. Taha's book, it wasn't just all the medical stuff. It was his emphasis on the human side of healthcare.
Oh, yeah. He talked a lot about patient satisfaction.
Right.
Which honestly isn't something I usually think about when I think about shoulder surgery. It's easy to get caught up in the technical stuff, but Dr. Taha reminds us that it's really all about the patient's well-being, their experience throughout this whole process.
He actually breaks it down into this formula for success.
Yeah.
11 factors that contribute to patient satisfaction, which is really interesting. It's like he's saying, hey, you're not just a shoulder, you're a whole person.
Exactly. And, those factors, they go beyond just the clinical outcome.
Right.
He talks about the value of time, both the time that the doctor spends with the patient and the time that the patient invests in their own recovery.
Which makes total sense. Like if you feel rushed or dismissed by your doctor,
right,
it's going to affect how satisfied you are with your care.
Yeah, absolutely.
Even if the treatment itself is successful.
And then there's this idea of passion. The doctor's passion for their work, the patient's passion for getting better.
Right.
It's that shared energy, that enthusiasm that can really make a difference.
I'm sensing a theme here.
Yeah.
It's all about connection, right?
Yeah.
Like building that strong rapport between the doctor and the patient, having that trust and understanding.
Absolutely. Which leads to another key factor.
Yeah.
Communication.
Yeah.
Clear, honest, and empathetic communication between the doctor, the patient, and everyone involved.
Right. No more confusing medical jargon.
Okay,
I think
right.
we've all had those experiences where you feel totally lost.
Yeah.
In a sea of medical terminology.
Absolutely. It's so important to feel like you're being heard.
Yeah.
And that you're being spoken to like a person, not just a set of symptoms.
And Dr. Taha also stresses the importance of the entire care team.
Yes.
Like the surgeon and the GP to the physiotherapist and the nurses.
And even the hospital staff, everyone.
Yeah, it really does take a village.
It does. And beyond the immediate care team, he even touches on these broader factors like the complexities of insurance.
Right.
And the healthcare system as a whole.
Which can be so frustrating.
Oh, absolutely. Huge sources of stress, especially when you're dealing with something as painful as a shoulder problem.
And he doesn't shy away from those difficult conversations.
Well, he even brings up something as seemingly mundane as the hospital kitchen.
The hospital kitchen? What do you mean?
He makes this really interesting point that, good nutritious food, tailored to the patient's needs, can play a really significant role in their recovery.
I never would have thought of that.
Yeah.
But it makes sense. Food is fuel.
Absolutely. It affects your mood, your energy levels.
Right.
All of that.
And lastly, he talks about the importance of research.
Yes.
Like really pushing the boundaries of what we know, seeking out these new and innovative ways to treat shoulder pain.
He's a real advocate for that, yeah.
It's really cool to see a doctor who's not only so skilled in the present moment,
right,
but also thinking about the future of their field.
It's inspiring. And, running through all of these factors is this idea of flexibility. It's recognizing that each patient is unique.
Yeah.
And that sometimes things don't go exactly according to plan.
So it's not just about sticking to a rigid protocol.
Right.
It's about being adaptable. Exactly. Being responsive to each person's individual needs and circumstances.
It's a truly patient-centered approach. Putting the patient's well-being at the forefront of every decision.
This has been such an eye-opening deep dive.
I agree.
I feel like I have this whole new understanding of shoulder pain now.
Yeah.
It's not just about the physical symptoms. It's about the whole person, their entire experience.
It really is. And Dr. Taha's book has given us so much to think about,
Yeah.
not just about shoulder health, but about healthcare in general.
And that formula for success, those
Yeah.
11 factors, it's like a roadmap,
Mhm.
for navigating your own healthcare journey,
Absolutely.
whether you're dealing with shoulder pain or any other condition.
It's about being informed and empowered as a patient, actively participating in your care, advocating for your own needs.
Well, I think we've reached the end of our shoulder pain deep dive. It's been an incredible journey, and I want to thank you, dear listener, for joining us.
It's been a pleasure exploring this topic with you. And remember, this is just the beginning. Keep asking questions, keep learning, keep diving deep into the world around you.